Established since 2013 in the City of Heroes, which is rich in diverse cultures. Nahdlatul Ulama Surabaya University, UNUSA, has a vision to become a leading and excellent higher education institution in ASEAN with entrepreneurial spirit and Islamic identity. UNUSA was established under the Surabaya Islamic Hospital Foundation, or YARSIS, a foundation formed and established by Nahdlatul Ulama. UNUSA was originally started in 1979 when YARSIS established the School of Health Nursing, or SPHEA. In 1985, YARSIS established the Academy of Nursing, AKPER, and the Academy of Midwifery, AKBID, in 1997, which in 2006 were merged into the College of Health Sciences, STICUS. It was this STICUS that transformed into UNUSA through the addition of several study programs, including the Faculty of Medicine. Despite its early establishment, UNUSA has become one of the leading private universities in Indonesia. Most of UNUSA's study programs have been accredited as excellent. UNUSA is also the only university that has 3 hospitals of its own as practice grounds for students. Having 3 campuses in Surabaya, UNUSA is equipped with complete and modern learning facilities, including laboratories, such as Virtual Reality Laboratory, Micro-Teaching Laboratory, CBT Laboratory, Biosafety Level 2 Laboratory, Anatomy and Histology Laboratory, Microbiology Laboratory, Integrated Research Laboratory, Medical Surgical Laboratory, Emergency Laboratory, Nutrition Laboratory, K3 Laboratory, Science Laboratory, Growth and Development Laboratory, Data and System Integration Laboratory, and many other laboratories. As a university that's geared towards international standards, UNUSA has also begun to pioneer an outcome-based education, OBE-based curriculum, a curriculum that focuses on outcomes. UNUSA has also developed a digital-based learning process through the eSorogan platform since 2017. To enrich the students' skills and experience, UNUSA has collaborated with a number of internship companies, such as Indosat, Helindo, KLM, and other companies. UNUSA's accelerated growth can be seen from its achievements, both at the national and international levels, such as ranked 16th best private university in Indonesia by Himago World University Ranking in 2023, ranked 9th best private university in Indonesia by Webometric World University Ranking July 2023, as the first best private university in MBKM implementation by LL Dikti 7, 31st National Ranking in Student Affairs from Kemenristekdikti 2021, and 2nd National Ranking in Student Affairs in Liga 3, ranked 24th PTN PTS in the 35th PIMNAS event of the Ministry of Research and Technology in 2022. Among the 231 permanent lecturers by 2022, 192 lecturers have produced articles in Scopus indexed international journals. The young lecturer Ahmad Shafuddin has been recognized in the world's top 2% scientists by Stanford University and Elsevier BV 2 consecutive years, 2021 and 2022. In the non-academic field, an UNUSA student won the gold medal in water skiing at the SEA Games in the Philippines. To accelerate its progress, UNUSA has collaborated with many parties, both domestically and abroad, so that UNUSA not only becomes one of the leading universities in Indonesia, but also in Southeast Asia. Sobat Muda Indonesia, are you ready to be part of the best campus of choice of the world-class community? UNUSA, promoting the perfect generation, professional, entrepreneur, Rahmatan lil Alamin, focused, empowering, creative, and talented.
angka kejadian stunting pada balita tertinggi di Indonesia. 5 provinsi tersebut ialah Jawa Tengah.
Tantangan kesehatan di Indonesia menjadi titik kritis yang harus ditanggulangi dengan baik. Penyakit menular maupun tak menular sering terjadi di negara ini. Upaya untuk mengkondisikan situasi ini dengan perencanaan kesehatan merupakan sebuah proses untuk merumuskan masalah kesehatan yang berkembang di masyarakat. Hadirnya Fakultas Kesehatan Universitas Nahdlatul Ulama Surabaya menjadi jawaban atas permasalahan kesehatan yang ada. Fakultas Kesehatan UNUSA berdiri setelah universitas memiliki izin Menteri Pendidikan dan Kebudayaan Republik Indonesia atas perubahan stikesiarsis menjadi UNUSA. Fakultas Kesehatan merupakan salah satu fakultas yang berintegritas dengan didukung program studi yang ada. Pada tahun 2013, Fakultas Kesehatan memiliki 3 program studi. UNUSA membuktikan perkembangannya pada tahun 2017 dengan menambahkan 1 program studi berdasarkan pada perizinan operasional Keputusan Menteri Riset Teknologi dan Pendidikan Republik Indonesia. Hingga saat ini, Fakultas Kesehatan UNUSA tercatat memiliki 4 program studi yang telah terakreditasi sangat baik. Keunggulan ini dapat dicapai dengan bantuan 4 program studi yang berada di bawah naungan Fakultas Kesehatan. Program studi yang berada di bawah naungan Fakultas Kesehatan UNUSA yaitu Program Studi S1 Kesehatan Masyarakat, Program Studi S1 Gizi, Program Studi D4 Analis Kesehatan, dan Program Studi D4 Kesehatan dan Keselamatan Kerja. Fakultas Kesehatan UNUSA memiliki keunggulan dalam berbagai programnya. Keunggulan program ini disajikan dalam bentuk kegiatan promotif dan preventif yang dilakukan sebagai upaya perbaikan kesehatan di masyarakat. Fakultas Kesehatan Universitas Nahdlatul Ulama Surabaya telah melahirkan banyak lulusan terbaik yang telah berpartisipasi aktif dalam menciptakan perubahan transformatif pembangunan kesehatan. Mahasiswa dan seluruh jajaran dosen Fakultas Kesehatan UNUSA juga aktif di berbagai kegiatan dalam skala nasional maupun internasional. Fakultas Kesehatan UNUSA didukung dengan fasilitas yang memadai, modern, serta berbasis teknologi digital. Tidak hanya unggul dalam prestasinya, Fakultas Kesehatan UNUSA juga aktif menjalin kerjasama dengan instansi di luar UNUSA, baik negeri maupun swasta.
Fakultas Kesehatan Universitas Nahdlatul Ulama Surabaya memiliki visi yaitu menjadi fakultas kesehatan terkemuka, unggul di bidang promotif dan preventif, profesional, berjiwa wirausaha, dan berjati diri Islami. Kami berkomitmen tinggi pada visi, misi, serta tujuan Fakultas Kesehatan Universitas Nahdlatul Ulama Surabaya. Kami mampu secara profesional memberikan yang terbaik dalam bidang kesehatan menuju masa depan yang gemilang.
Fakultas Kesehatan UNUSA berkomitmen untuk meningkatkan derajat kesehatan masyarakat melalui ikhtiar promotif dan preventif, serta mempersiapkan sumber daya manusia yang berkualitas dan profesional yang akan bertanggung jawab mengembangkan ilmu pengetahuan dan teknologi, khususnya ilmu pengetahuan dan teknologi di bidang kesehatan. Dengan didukung oleh staf pengajar yang kompeten dan profesional, fasilitas yang lengkap dan modern, lingkungan yang kondusif, serta layanan yang terbaik pada pelaksanaan kegiatan yang akademik, ataupun yang non-akademik. Fakultas Kesehatan UNUSA akan terus bergerak maju, memenuhi tantangan global, dan insya Allah selalu siap menjadi pelopor kesehatan yang unggul di tengah-tengah masyarakat.
Bersama Fakultas Kesehatan UNUSA, kita wujudkan generasi rahmatan lil alamin.
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asrofil anbiya'i wal mursalin Sayyidina Muhammadin wa ala alihi wa sahbihi ajma'in, amma ba'd. First of all, let us raise our praise and gratitude to Allah Subhanahu wa Ta'ala, who has graciously bestowed His mercy and guidance and enlightenment upon all of us, so we may gather in good health to participate in the series event of guest lecture held by Public Health Study Program, Faculty of Health, Universitas Nahdlatul Ulama Surabaya, with theme Mould Exposure and its complication for respiratory health. We also extend our prayer and blessing to our noble Prophet Muhammad SAW, whose loyalty and wisdom have led us from the era of ignorance to bright era of Adinul Islam wal Iman. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Let me introduce myself. My name is Aira, as a moderator who will guide today's guest lecture from the beginning to the end of the event. On this special occasion, please allow us to express our gratitude and warm welcome to our honorable, incredible speaker, Dr. Sabha Nisar from University of Derby, UK. To Honorable our Head of Public Health Study Program, Mrs. Dwi Handayani, SKM MPit, the Honorable our Rector of Public Health Study Program UNUSA, and to all happy students of UNUSA who joining today's guest lecture. Today's guest lecture topic is really interesting because we now surrounded by our friends and colleagues that have caused stuffy nose and itchy throat. Because of the unpredictable weather nowadays, it can be caused by mold. Mold is a microorganism fungus that grow in damp environment and can affect respiratory health. Studies in Bandung that there is a urban space have found relationship between damp condition, fungi presence, and respiratory problem, especially in kids and elderly. For example, acute respiratory infection, or known as ISPA, or infeksi saluran pernafasan akut, is leading cause of death in children under 5 in Indonesia. I hope you all listen closely to the lecture that Dr. Sabha will be sharing today. But before we begin, don't forget to turn on your camera and use our background video background. Please ensure that your microphone are muted to minimize any background noises. As you all know, from our poster, our speaker is Dr. Sabha Nisar from University of Derby, UK, who's expertise in public health lecture and research for 10 years of experience in health project, patient care improvement, and teaching. She holds a postgraduate certificate in higher education from University of Derby, a Master of Public Health, and additionally, she obtained a Bachelor Dental Surgery from University of Health Science, Pakistan, and Bachelor of Science from University of Punjab, Pakistan. Currently, Dr. Sabha is Program Lead at Master of Science Leadership in Health and Social Care of University of Derby, UK. She also Public Health Lecturer of University of Derby, UK, and RIPA University, Islamabad. Dr. Sabha also has served a lead research coordinator at Hamas Medical Corporation in Qatar, health education officer at Heart Research UK, and also fellow National Health Service Research Staff Member UK. Dr. Sabha also has achievement include establishing at the Qatar National Primary Immunodeficiency Registry and managing allergy and immunology awareness program who nominated for awards. She has authorized numerous scientific publication and presented at international events. Dr. Sabha also has certificate at FHEA or Fellow of Higher Education Academy, member of RSPH, Royal Society of Public Health, and also member of Pakistan Medical and Dental Council. So that's the CV of our speakers today. So if you have question during the presentation, please use the raise hand feature or type your question in the chat box. We will have a question and answer session in the end of Dr. Sabha presentation. Perhaps maybe before we start discuss the interesting topic, may I greet today's speaker first. Hello, Dr. Sabha. How are you today?
Hello, and thank you for inviting me. It's an honor being here at the University of Surabaya. Thank you so much. And I'm looking forward to sharing my knowledge and expertise related to mold exposure and its implications in respiratory health.
Okay. About today's topic, is it mold exposure also become interesting topic in UK?
Yes, very much so, because mold exposure is an issue that is quite prevalent in the UK. It's probably because of the weather that we have, cold, dampness, and what we've seen in the past, 2 decades, there has been a relative increase. And in today's session, I will be talking about the prevention and the mitigation strategies and what policies are in place in order to tackle and mitigate these mold exposure effects.
How often UK has case of respiratory problem that caused by mold, Dr. Sabha?
Yes, there's quite a lot. If I say on a per year basis, we've got 5,000 to 7,000 cases that are specifically for mold exposure. So we've have people facing asthma, allergic rhinitis, allergic conjunctivitis, and there are also issues that are pertaining to more seriousness. That is pneumonia related to mold.
Okay, now we had something in common from UK and also Indonesia about this condition. Okay, right now I can hand it over to you, Dr. Sabha, to take us through the topic today. Time is yours, Dr. Sabha.
All right. Okay, so today's session is primarily going to be on mold exposure and its implications for respiratory health. I will be talking related to my experience and expertise, specifically pertaining to the UK environment. And of course, I'll be drawing examples and a few strategies that are in place internationally as well. So, Ira, will you be moving the slides or? All right, no problem. Okay, so before we start off the session, a little bit of the objectives that we have, so that we are taking something out of this 1 hour session. We will be recognizing the common sources and types of indoor mold exposure. We will be looking into the mold effects specifically for the respiratory health through allergic and the infectious pathways. What are the main risk factors for mold development and exposure, and what are the vulnerable population that are mainly affected by it? We will also be looking into the association of mold exposure to respiratory diseases such as asthma and, of course, the chronic obstructive pulmonary diseases. We'll be looking into a few strong studies that are the systematic literature review, meta-analysis, and other epidemiological studies that have published strong association. We'll be looking into UK and international policies and the responses to mold-related health issues. We'll also try to understand the prevention and mitigation strategies at an individual level and policy level. And as public health professionals, what is our role in order to mitigate it and what we can do as a community as well. Right, starting off with some straight up facts. First of all, we all understand that air pollution or any type of indoor or outdoor pollution has led to a lot of deaths. 7 million deaths per year are linked to this type of pollution. And by that, what I basically mean are biological contaminants. That could be dust mites, it could be parasites, it could be mold, it could be chemical pollutants. I'm talking about volatile organic compounds. I'm talking about combustible material. I'm talking about gas, NO2, hydrocarbons, so on and so forth. But as this session is more focused towards the mold exposure, a few stats say that in 2019, the presence of damp and mold in English residences were estimated to be about 5,000 cases of asthma. and around 8,500 lower respiratory tract infections among children as well as adults. In addition, damp and mold were estimated to contribute to around 1 to 2% of new cases of allergic rhinitis in that same year. So what is mold, right? We do understand it's a microorganism, but like having a certain definition is important, and having a little bit of background in terms of what the biology is, so that we better understand the physiological pathways, how it does affect different populations, and what we could do in terms of the prevention measures. So molds are microscopic fungi that grows in the form of multicellular filaments called hyphae. They thrive in damp, warm, and humid environments. So that basically tells us, like, all the places which have a tropical climate, it is much more prevalent over there. It can reproduce through spores, which can become airborne and inhaled, potentially affecting the human health. Now, when we talk about spores, the spores can be as small as like 5 to 10 micrometers. They are extremely lightweight. They are dry, so it makes it easier for them to travel through air, and obviously it also makes it easier for us to inhale it. And of course, like, the aftermath in terms of like invasion within the alveoli, causing inflammation, causing infection, becomes hereby much easier. Now, when I talk about the spores and pollutants, one thing that comes into mind is that it is resistant to desiccation. It is resistant to UV radiation as well. Most of the spores are, and most of the spores are also resistant to slight temperature changes as well. So that makes spores easier to thrive in those environments, and hence it also makes it easier for them to reproduce and, of course, cause pathology. Right, so one of the common indoor mold species that we have is, of course, the Aspergillus, the Penicillium, Cladosporium, Alternaria, and the Stachybotrys cartarum. The images you can see is like something which is fairly common. We can find it like, under the windowsills, the doors. We can find it like, around the areas which are more damp, specifically like, the areas around the washing and the bathroom areas. Right, in terms of when I talk about the mold growth, one of the parameters we need to understand, how is it growing? What are the factors that accentuate the mold growth? And what is it that we can say is a high risk associated area? One is airborne mold spores. We do understand that the indoor total spore counts should not exceed the outdoor levels under the normal conditions. So whenever we are trying to find out the indicator that why is there an increased mold exposure within a closed environment, we always draw a comparison between the indoor spore count and the outdoor spore count. And if we find it higher, that basically means, if it's 2 or 3 times higher, that basically means that there is significant mold exposure risk within the confinement. Humidity as well, ideally it has to be less than 60%. However, in many tropical areas, that is surrounding the coastal area, the surrounding like, the Southern Asian countries, as well as like, I would say Indonesia, Malaysia, we have seen the humidity level can rise up to 80%, which provides a very favorable environment for the mold growth. We've also seen the moisture content of materials that should be ideally less than 15 to 17%. Now, there are certain materials used within the building materials, or let's say, I would say it is used within like, our home confinement, has the capacity to trap moisture. So if I'm talking about certain materials such as wood or drywall, they're more prone to mold growth. That is because their moisture content is fairly higher. If, let's say, if I compare it with concrete building material. Another thing is carbon dioxide and temperature. Now, this is basically used as ventilation indicators. Now, one thing that is very important to understand is, like, if we're talking about indoor mold exposure, one of the prevention strategy is to have more ventilation, right? Now, the ventilation is assessed by what the temperature is and what is the CO2 levels. The high CO2 levels and low temperature may correlate with how poor air exchange is happening within the internal confinement of the room. And that helps us tell if there's a high level of condensation or vapor involvement. And that basically tells us that this is a favorable environment for mold growth. Next, please. Right, so if I look into the specific mold species or examples, one is the Aspergillus, and we do identify that is present frequently in damp buildings, on wallpapers, carpets, and upholstery, such as we're talking about sofas, upholstery, the dining chairs, curtains, so on and so forth. And it can cause lung infections such as aspergillosis in people with weakened immune system. When we talk about aspergillosis, one of the key symptoms of it is cough, fever, sputum, and if I talk about the more severe categories of aspergillosis, it's it can be disseminated to other organs of the body as well. Talking about penicillium, it's also one of the very common fungi spores that we can find, and it's found mostly on gypsum boards, the carpets, upholstery as well. And it is recognized as one of the most common molds causing the allergy symptoms. Now, I will be talking about what are the pathways that it can cause certain respiratory reactions. It could be allergic, it could be hypersensitivity reactions, or it could be something a bit more serious. But penicillium is mostly confined to having a little bit more allergic symptoms rather than having more infectious symptoms. Next, please. Next is the cladosporium, which is among the most frequent molds in indoor air, easily transported through air from outdoors, and it is typically allergenic rather than directly pathogenic. And by allergenic, I mean it could cause simply rhinitis, it could cause runny nose, it could cause fever, cough, but it is not essentially pathogenic. Now, Alternaria, it's also often found in indoor and outdoor air, listed among the common molds causing allergies. And lastly is the Trachobotrytis cartum, very interesting one because it's also known as the black mold. It grows on water-damaged materials, and while labeled as toxic black mold, there's evidence for severe health outcomes remains limited and inconclusive. However, it is very much commonly found. Right, next please. Yeah. So if I'm talking about mold exposure, and you are now aware of what are the different mold species that are causing indoor mold growth. Now there are different types of exposure, and it's important to understand how, if it is out there within your room confinement, it is either in the visible format or in an invisible format, or it is in between the layers of the wall. The type of exposure is important to understand that how it's going to affect a human. One is inhalation, that is breathing in airborne spores or fragments is the most common one, because as I mentioned, it's extremely lightweight and dry. It's extremely small in size, at around 5 to 10 micrometers. So it is easily dispersed within the air, and it can be inhaled very commonly and can reach the alveoli in the lungs and cause the pathogenicity. Now, it could be skin contact as well, because we have seen the visible mold on the walls and everything. So if, let's say, if you are in contact with it, if there's a skin contact, it could cause a certain type of hypersensitivity reaction. It could be, you can have those allergic rashes. And of course, this definitely causes some sort of an allergic response. Ingestion is also one other form of exposure, because obviously the spores can get deposited within your food, within your drinks, and it can thus cause consumption of mold. But as we are more focused on the inhalation or the airborne mold over here, so we will be talking more about the inhalation part of it. Next. So how does mold exposure affect the respiratory health? Before I start that, we need to understand how mold is sort of identified, assessed, and how do we actually basically measure how much spores, what is the spore count, or what is the measurement of the mold infestation within a house facility. So one of the strategies that is basically followed internationally is one, if let's say if we want to assess a building, that how much mold exposure is by the humans over there. So what we do first is we sort of we disseminate a questionnaire survey asking about what is your health, how many times, what is your duration of exposure or the frequency of exposure, how many times do you if it's a workplace, how many times do you come in, or let's say we're talking about what is the condition of the washrooms, if do you visibly see any mold, or is it something that that it's still damp but probably it has to be investigated. One is a questionnaire survey. Second is you always go for the physical survey. That is, you basically have the team in place and they will be like, okay, if this wall is damp, we might be stripping to see if there is mold infestation within that area or not. It could be like, within the walls, it could be like, let's say under the ceilings, it could be like, on the floor, wherever they find it. Next is the sampling. How do you go forward with the sampling? One is the air blow technique, right? So basically what you do, you try to find out the spores that are before blowing and then after blowing. So that basically tells us like, that usually the spores that are basically not, they are not mobile if there's not enough ventilation or air in. So when you blow, or that is basically a more manual mechanism, you can see that that those pairs and those hyphae can actually like infiltrate the air, and that is more easier for the samples to be taken. So the sample could be taken like more on a surface basis, or it can also be taken like on an air sampling method. That is, you're basically using strategies such as the NASA, or you're using strategies such as Anderson samples, and you're basically trying to grow those samples on your agar plate and then trying to find the colonies. Right, now what is the link between the exposure and the symptoms? We have spoken like enough that okay, there are like certain exposures in terms of the spores or like the toxins released, and obviously the hyphae that can potentially cause an immunological reaction. Now this immunological reaction could be initiated through type 1 hypersensitivity reaction, or it could be type 3 or type 4. Now, when you're talking about that, what is basically happening is this, it reflects on the symptoms caused by these mold spores. So it could be cough, it could be wheezing, it could be dyspnea, asthma attacks, as I mentioned, or it could just be mild throat irritation, or it could be just like, the nose irritation in terms of like, you're having just a runny nose or stuffy nose or itching. On more severe cases, we have seen a high rise in terms of rhinitis, asthma, exacerbation of asthma. If people are already having asthma or any COPD disease, there has been an increase in those diseases as well. There has been infection as well as allergies that were not previously seen, but they have developed after the mold exposure. Yes, please. Right, now briefly touching upon the pathophysiological mechanisms of like, how does spore affect us. If I start off with just inhalation and deposition, it's basically the spores and fragments, when they're inhaled, the smaller particles, they reach the bronchi and the alveoli, and they sort of deposit over there. It can simply cause runny nose or nasal congestion, or it could just be epithelial irritation and innate inflammation. That is basically the mycotoxins are released and the cytokines are released, and that just sort of initiates a cascade of type 3 hypersensitivity reaction. Or it could just be a type 1 hypersensitivity reaction that is just an allergic sensitization. If there's a repeated exposure to an allergen, that is the mold, what happens is basically a persistent antigen exposure initiates the type 3 and type 4 hypersensitivity reaction. That is basically the exposure to the antigen causes the release of T cells to release the cytokines, and these cytokines sort of like recruit the macrophages and the cytotoxic T cells to initiate an immune response, and which is much further, I would say, severe as compared to your type 1 hypersensitivity reactions. Lastly is your opportunistic or the invasive infection. What happens is that in immunocompromised hosts, and that by basically I mean vulnerable populations such as more elderly people, or it could be the younger lot, the younger children, or the pregnant women, there could be a high risk of spore germination or reproduction, or the hyphal invasion of tissues and blood vessels. Now, when this happens, it can cause more invasive pulmonary aspergillosis, and disseminated fungal infection can happen. Right. So as I spoke about, like, our main focus is going to be inhalation or the airborne mold exposure. So as you can see from the diagram over here, it's just an example of the Aspergillus specific mold, and how the asexual spores, because of as they are airborne, they are found within the air medium, and they could easily enter the trachea and reach the lung and the alveoli. And this happens because the concentration can range from 1 to 100 per meter cube, and that also depends on the intensity or the extent of mold infestation that has happened in the area. Now, a human can inhale approximately 100 to 1,000 conidia per day, which is relatively a huge number. Probably for more healthy individuals, it is something that can be easily passed off because as you can see from the diagram below, what happens is that if you are immunocompetent, what happens is that the mucociliary movement basically swipes away all the spores and it is sort of excreted. However, what happens in immunocompromised individuals, the mucociliary are not functioning in their proper way. So these spores, they start germination within those epithelium, and they can easily surpass the trachea and they can reach the alveoli epithelium. Or what happens is the phagocytosis by macrophages, or your blood cells, white blood cells, they are not functioning enough in order to incorporate or act or kill these spores then and there. Right. I spoke about the hypersensitivity reaction because that is one of the primary ways of how you develop those allergic symptoms. You develop those respiratory symptoms on the first hand. Now, just for the people who don't have a medical background, we do have a range of hypersensitivity reactions that can take place in our body. It could start from type 1, type 2, type 3, and type 4. Exposure to mold, that's basically confined to type 1 and type 3 and 4. Now, type 1 can happen rarely, but type 3 and 4 is relatively common in terms of the hypersensitivity reaction. So what is a type 3 hypersensitivity reaction and what could be the symptoms? Now, type 3 hypersensitivity reaction is basically talking about the antigen and the antibody complexes. When they are found, they are basically are produced in excess amount and they are deposited on the tissue. When they are deposited on the tissue, it activates a complement cascade or a complement system that initiates an immune response, and that could result either in wheezing or rhinitis and runny nose, so on and so forth. If, let's say, there is a repeated exposure, that is the antigen or the mold exposure is repeated or on a chronic basis, what happens is that the T cells are released. These T cells, they release the cytokines, and the cytokines they recruit the macrophages and cytotoxic T cells to initiate the immune response, as you can see in the type 4 diagram. Now, when this happens, it causes a delayed hypersensitivity reaction. That basically means that it can cause much more severe reaction in terms of their symptoms of the individual. Right. Some of the studies that has found a strong correlation or an association between the indoor dampness or the mold along with the respiratory symptoms that we have seen. Now, a very key systematic review and meta-analysis that was published in 2013. This basically meta-analysis is a study that involves 31 studies, and we are trying to find out the major determinant or the major causative factor between rhinitis, or what is the causative factor of rhinitis when there is water seepage, when there is dampness involved, or when there is mold odor involved or mold exposure involved in general. So individually, the meta-analysis was conducted for each variable, that is your water seepage, your dampness, your mold exposure, your mold odor. So what has been found out that rhinitis, allergic rhinitis, or rhinoconjunctivitis, that is specifically focusing on the rhinitis, were included. And we have seen there was a largest risk was observed in relation to mold odor. That was kind of surprising. That is, if I talk about the dampness, if I talk about the mold, the surface mold, the surface mold exposure or the mold odor had the highest odds risk in terms of developing rhinitis. As you can see, that rhinitis is 2.18 in terms of the odds risk as compared to the other allergic rhinitis or the risk related to visible mold, which was also consistently increased, but the mold odor had 2 times higher risk in terms of development of rhinitis. In addition to all this, we have also seen that the exposure to dampness were related to increased risk of all types of rhinitis whatsoever. However, the mold odor definitely had a more significant result in terms of the odds risk development. Yes, please. There's also one more study that I would like to share. It's one of the most strong studies, I would say, that is related to the respiratory health in Northern Europe, which is also known as the RHINE-2 study, which basically sees the dampness, mold, onset, and remission of adult respiratory symptoms, asthma, and rhinitis. Now, the design of this study is particularly interesting because it is a longitudinal study. It is conducted at 2 points. That is, once it was conducted in 2000, where a baseline questionnaire was given to individuals, that is primarily the adults, and we were trying then to find out basically what is the general respiratory health of the individuals in the particular environment, and assessment of the workplace or home where they work or where they live. What is the dampness level? Let's say, what is the mold infestation level? And in terms of if there are any leakages, in terms of ventilation, so on and so forth. Now, the baseline questionnaire was given in 2000, and then 10 years later, in 2010, another questionnaire was given just to assess if the same questionnaire was given in terms of if there has been any changes or drastic changes in terms of their respiratory health. Have they developed any COPD? Have they developed any asthma exacerbation? Have they developed any allergic symptoms? So on and so forth. And if there has been a persistent exposure to mold throughout these 10 years, or has there been an improvement in their work conditions or their health conditions as well in terms of their home as well as work vicinity. Now, when this is done, obviously around 11,506 individuals were recruited, and it was kind of strong study because of a very strong sample size. And what we have seen is across Europe, that is across the 5 countries, there were 7 centers developed in Norway, Sweden, Iceland, Estonia, and Denmark. And the results were kind of compelling because what we could see is the baseline water damage, the flow dampness, mold, and mold odor at home were associated with an onset of respiratory symptoms and asthma with a strong odds risk ratio of 1.23 to 2.24. What we've also seen over here is that we also wanted to see if the remission of adult respiratory symptoms was done. That is basically, in 10 years' time, have your respiratory symptoms or health improved, or have they remained the same, or have they sort of decreased from the normal value? What we have seen is if obviously the variables or the exposure to mold was consistent, there has not been any significant improvement. The remission had significantly decreased, and obviously their adult respiratory symptoms or their conditions had considerably worsened with time. So as you can see at the end, the dampness and mold at home and at work decreased remission of the respiratory symptoms and rhinitis. And obviously we could see flares that were never seen before, and people sort of developing the extreme symptoms due to continuous exposure across those 10 years time. And that also reflects on the fact that that how this the association between dampness and mold and the respiratory health is becoming more and more significant in terms of in terms of the mold exposure on a continuous or a chronic basis. Next, please. Right. I would like to share one case study, and the reason for sharing this is because it is kind of linked to something that has recently happened within the UK, and which has led to a very important legislation that was developed in the recent years. Right. This is a case of a little boy, 2 years old, Awar Visak, who was living in a social housing in the Rochdale Social Housing Society, and was affected significantly by the indoor mold spread. Now, just to give a little bit of background, within the social care system, there are provision of obviously the social or council housing. Now, the social council housing do not have standards that are really good in terms of how the maintenance and the repairs are conducted within this housing society. So this particular child was particularly affected by the mold spread because there were like continuous leakage, seepages, dampness, poor ventilation that the family was being exposed to over a large span of time. So this child was born in 2018, and even pre-2018, I would say even from 2017 onwards, the parents were continuously sort of like, looking or sort of like, tapping, reporting about like, the significant mold that was found on the walls, in the washroom areas, obviously like, because they were continuously consuming, it was visible mold, the air was infiltrated with it. There was like, minimum ventilation because it was mostly single glazing windows, and there was like, inefficient heating system as well. Now, all this has led to issues that the Wahab actually developed. He sort of like, developed continuous infections, continuous allergic symptoms, and continuous doctor visits. So what happened like, between 2017 to 2019, there were like, continuous reports about this particular social housing that was provided to the family. From June to December 2020, the family initiated a formal disrepair claim because the landlords were not obviously sort of like taking action in terms of like, if they could do anything in terms of like the leakage and the dampness that was found, because he was continuously asked to just paint over it, because you can't just paint over it if the mold is still there, because the mold or the spore will germinate no matter what, even if you paint over it. So the inability of the housing society to take action or to take timely action did have adverse effects on Awab Ishaq. Next slide, please. So this child actually faced a lot of respiratory issues, and he died of severe granulomatous tracheobronchitis leading to an acute airway edema and cardiac arrest. That was indicating that spores from the mold, obviously entering his respiratory system over time from continued exposure, caused a chronic inflammation that eventually occluded his airway. He died in December 2020. Now, this particular incident sparked an outrage in terms of like, whether the regulations that are in place, whether the enforcement of the law is enough or not, or whether the tenants and the landlords, the association of rights over each other, what are they? They need to be clearly defined, because it had a significant impact on like, a child's death. Following this, I will be talking about the policies that were developed in place. But before that, I would like to share one report that is basically also talking about the poor indoor climate and its impact on health and life satisfaction, as well as its wider socioeconomic cause. Because when we talk about like, that most of the people or the population that are affected by mold exposure or growth, they are from a lower socioeconomic background. And while I say that, it has a clear implication on what is the healthcare cost, what is the affordability, what are the social inequalities that they're facing, and what are the things that sort of like, aggravate the mold exposure. And what can we do about it? So there is this report that was released in 2022 that basically sort of tallied the poor indoor climate, that is the dampness, the ventilation, the noise, and obviously the mold odor, and its impact on health and life satisfaction, obviously looking into the wider socioeconomic cost. And if I talk about the direct healthcare cost that was attributable to damp and mold and a lack of daylight in the residential buildings across the EU 27 nations, it was estimated to be 1.9 billion for the EU minus 27, that is obviously prior to the Brexit, and 2.7 billions for the 27 EU countries plus a few more. So which it was a significant cost that was incurred. Next, please. Yeah. So if I look into the relative risk of damp and dark housing conditions by the health conditions, as you guys know, that in the European countries or the UK, it's mostly the climate is damp, but it is cold, right? So if I look into the risk factors and the relative risk factors that were associated within this report, it was seen that the dampness, key risk factor, was associated with asthma, upper respiratory tract infection, lower respiratory tract infection, as well as depression. And the relative risk was fairly high ranging between 1.3 to 1.6. And if you see the healthcare cost that is incurred by treating one person in Europe per year by health condition, just for asthma, it was around 2,150 euros. And for an upper respiratory infection, that could just be rhinitis, that was 71 euros. Lower respiratory infection was 87. Depression, again, is high, it's around 880. But this also relates to the fact that, that how not treating the baseline condition could have far-reaching effects on the health and social care sector. That is basically, more pressure and more burden on the healthcare facilities. Specifically, if I'm talking about the UK, talking about more pressures for the NHS, for more, obviously, having the patients over and the cost that the economy incurs. Next, please. Now, if I specifically talk about the environmental and structural factors that could lead to mold exposure or the mold development. One is obviously the dampness and the water leaks. And why it is important to sort of identify those factors and sort of organize those factors in themes and sub-themes so that you can treat accordingly. So if I talk about dampness and water leaks, obviously coming from plumbing, roofing, or flooding, or poor ventilation, that is single glazed windows, limited air exchange, especially in areas where the dampness is high, that is kitchen or let's say the toilets, or the moisture buildup could be really high. Cold indoor temperatures. Now what happens is when you have cold indoor temperatures, that promotes condensation on the walls and windows. That is within the confinement, you don't have the heating or the ventilation on. Now, when this happens, the temperature inside sort of drops and condensation develops. Now, most of the households are facing fuel poverty, that is basically not having enough energy resources to sort of warm their homes. And that is probably reflecting also on the inability to afford, basically. So they need more energy is consumed, higher bills, higher living costs, so on and so forth. That sort of accentuates, it's mostly like a cascading effect that, that if you can't afford, of course, there are higher energy bills, there's more condensation, there's more moisture development, and of course, there is more mold exposure as well. Inadequate insulation and high indoor humidity typically reflects on high mold growth, and use of porous building materials such as untreated wood, carpets, wallpaper, which retain a lot of moisture. Next, please. There are certain other factors such as socioeconomic and housing factors, as I mentioned. Overcrowding housing. You must have seen a lot of mold exposure in overcrowded housing, or mostly in social housing, that I could say, because there are large families that are under one roof. There's increased moisture from respiration, cooking, washing, drying clothes within the closed environment. Poor housing quality. We all know there, specifically if I'm talking about areas where there is a need for economic development, there has been a rapid urbanization, and that rapid urbanization is coming at a cost of having houses built which are more in quantity rather than focusing on the quality of the housing. Fuel poverty, as I mentioned, is inability to adequately heat your homes. That is leading to condensation and dampness as well. We are also talking about maintenance and repairs, because any housing, if there's a wear and tear, there is a requirement for repair. And obviously, if timely repairs are not conducted, there is continuous leakages, dampness, and all this water or moisture is being collected in those gaps and pockets. It can definitely lead to an increase in mold growth. Few of the factors are environmental and climatic, that is high rainfall and humidity regions. So if I specifically talk about the tropical areas or the tropical regions, that is coastal or temperate climates, UK is one of those main areas where we are facing the coastal regions, and there's a high humidity index over there and high development of moisture content in most of those houses as well. And climate change that we all are experiencing, there's an increased frequency of extreme weather events, there's flooding, and obviously there is not enough time in terms of development of in terms of repair, or obviously in terms of building new houses or building better quality materials. Ira, can I get the slides back, please? Yeah, thank you. Right, behavioral and occupational factors as well, because as we can see, there are poor household ventilation practices, there are drying clothes indoors, not extractive fans. Now, most of the cold or the Western climate areas are as such that the ventilation or the one of those practices that, let's say drying clothes indoors or cooking indoors, let's say, can cause, the water vapor to rise, can cause the air the quality to get more moisture and more humid, which can definitely increase mold growth. Occupational exposure, we've got farming, waste management, construction, or working in damp environments where you are continuously, chronically exposed to damp weather and development of molds. Use of humidifiers or water damage, the air-conditioned systems can spread mold spores indoors as well. Next, please. Now, if I talk about the vulnerable population that are mainly affected by this mold exposure and that are basically not immunocompetent, I would say infants and young children, because they are still in stages of development of their immune system and they're mostly affected. Older adults, that is population talking about 65 plus, 70 years. Individuals with respiratory diseases. Now, people who are already having asthma or allergic conditions, or let's say chronic obstructive pulmonary diseases, when they are exposed or continuously exposed to mold, they sort of have the exacerbation of these symptoms and it can cause more severe diseases. Immunocompromised individuals, obviously, because they cannot initiate a hypersensitivity reaction or there's a delayed hypersensitivity reaction that could affect the way they are, the way they consume the mold and the pathology of it. People with skin condition, and this is kind of interesting because eczema and dermatitis, people who already have these conditions are particularly affected more by inhalation as well as the surface contact with mold. And one of the reasons of that is because eczema basically causes your skin barriers to have cracks. So basically your when you have that surface contact, it can cause more irritation because of the spores. Another thing what it could do is eczema is basically associated with immune dysregulation, which in layman terms basically means that that the hypersensitivity reaction can be more adverse as compared to a normal healthy individual. Individuals with mental health conditions, obviously, and bedbound or housebound individuals are also one of those vulnerable categories that are affected more or are at a higher relative risk of mold exposure as compared to the normal individuals. Right, coming on to the UK and international policies, because one, we understand the pathology and how the mold spread can affect our respiratory health, but there are certain UK and international policies that are already in place in order to combat or mitigate the effects of indoor mold spread and exposure, and how the WHO has sort of devised a whole category of core competencies that a house or building material should have in order to sort of mitigate the effects of mold exposure. So I'll be touching upon what is the UK Regulatory Act. Now, regulation on damp and mold in social and private rented properties. Now, we have a Housing Act 2004 in place. We've got the Environmental Protection Act. We've got the Landlord and Tenant Act 1985, minimum level of energy efficiency standard as well. Now, while I'm talking about all these building regulations and those housing acts that are in place, the reason why it's important to have these act as a guidelines so that the building materials or the building regulations that follow it is important because this is going to have a long-term impact, number one. Number two, enforcement of law is important because even though if you have the law and the guidelines in place, it is important to have that enforcement, the continuous reminder to people to follow these regulations and act in order to not have any adverse effect in terms of having the legal notices sent and all that. Next, please. Right. Now, I spoke about a case study about Awab Isaac and how that young child, 2 years old, who died because of the mold exposure within the social housing. Now, because of this death, there was a series of campaign and protests that took place, and Awab's law was introduced in July 2020 2023 as part of the Social Housing Regulation Act. Now, the government has now confirmed very recently on the 27th October 2025, he has confirmed the requirements that will come into force through the AWAB's law. Now, that basically means that all the registered providers of social housing will have to meet the requirements that are basically listed, that are if there is any complaint by the tenant in terms of mold exposure or any leakage, that has to be met within 24 hours. If not, a legal notice can be initiated. Let's say the tenants will be able to hold their landlords accountable in the legal court, or if there's any breach of contract done. So which is a phenomenal development in terms of the act that has been implemented, because the building regulations has now been enforced. And that, of course, that has also because of the public health awareness and the campaign that were initiated by it, and that that's how led to a strong action that was taken by the government. Next, please. Right. While we talk about the UK policies, the international policies, obviously, in every country is different, is variable in terms of the obviously the means that they have, and how they prioritize tackling with mold exposure. But WHO publication on guidelines for indoor air quality, dampness, and mold gives a very accurate guideline on how the buildings and the moisture control and what is the prevention and mitigation strategies that should be implemented. Number one is obviously the prevent and remediate dampness, that is preventing the dampness and moisture, that is treating, repair the leaks as and when they come up. Obviously looking forward to ensuring there is continuous ventilation during the summer months as well as the winter months. Controlling the moisture sources, ensuring there is adequate ventilation, inspection and maintenance. One thing which is very important in public health is surveillance, right? So if we talk about surveillance, that basically means continuous inspection, assessment of the area, that is making sure that it is meeting the regulation, let's say every year or so, or every 2 years or so, making sure there is maintenance that is done promptly whenever there is a complaint. And a public health approach basically means that the public health prioritizes this, not merely aesthetic or maintenance issues, but it should prioritize, because obviously the health is at risk for the individuals, and there should be intersectoral collaboration. That there's obviously, it's not only focused on that we should be funding more of the healthcare sector, that is sort of funding them more in terms of providing people coming in with respiratory issues, but obviously treating the root cause as well. That is talking about having the building act, building regulations in place, having more inspections in place, improving the building materials that are used, which obviously jointly works as such in reducing the mold exposure. Yes, next please. Right. Lastly, talking about the prevention and mitigation strategies, what should be in place, talking about what we could do individually as a community and obviously at a policy level as well. Right, the moisture control and the source management. One thing is obviously identifying and repairing the water leaks, improving the ventilation, dry wet materials within 24 to 48 hours, maintaining the indoor humidity levels that is below 60%, and that is, let's say, if we don't if we don't know, or if we're not aware of how to maintain them, there are continuous inspection in place, or those humidity meters that one can place and ensure that the humidity levels are below 60%. Ensuring proper drainage and insulating the cold surfaces to reduce the condensation. Obviously, talking about the building design and maintenance that I've spoken about, using mold-resistant materials. There has been a lot of innovation in terms of the using the mold-resistant materials in high humid areas instead of just using gypsum boards and wood, which sort of retain the moisture content. Incorporating an adequate ventilation system and avoid oversealing the buildings. That is, without balancing the ventilation needs, specifically in those areas where that the dampness and water leak risks are quite high. Cleaning and remediation, this is one of the key issues. Let's say if through the inspection there is visible mold growth and you can actually see that it can be easily removed using the detergents and water. Avoid dry brushing or vacuuming. And why avoid dry brushing or vacuuming? Because what happens is that vacuuming sort of releases the spores, and it makes them more mobile within the and increases their number within the air quality. So it's always better to use the detergent and water medium in order to get rid of it. Disposing the contaminated material. That is, if there is a mold development within the carpet, upholstery, or shower curtains or anything, you need to dispose it immediately. Using obviously the personal protective equipment while doing so, engaging professional remediation services, and avoid using bleach as a long-term solution. It can mask rather than remove the mold and may damage the surfaces, and that is one of the cheapest way that we use to get rid of the mold is just by using bleach, but that does not give a permanent removal. Right. Lastly is about the role of public health professionals and researchers. Now, being public health professional, and in any capacity, I would say, if you're working for the health promotion sector, if you're working in research, or if, let's say, if you're working in terms of as a practitioner, actually conducting those assessments, or whether you are in the epidemiology sector, one thing is clear that that every part of public health is affected by this. That is, if let's say you need to adhere to UK building and housing standards, and that is something that can only be done through continuous research, guidance, and informing the policymakers. You cannot obviously have the data without any research done. So ensuring that that the continuous assessments, continuous surveillance is done, research is continuously being done, and the policymakers being informed, addressing the fuel poverty and inadequate housing. If we talk about the social determinants of mold exposure or the fungal infections, one of the key things is poor housing. And you will see a high amount of indoor mold growth, specifically in housing that is among the lower socioeconomic group or those privately rented properties. Now, what is happening over here is obviously there is poor insulation, there is single glazing, they are not dampness proofed, the fuel poverty is quite high. So obviously they are not able to they're not able to mitigate the effects of mold exposure or growth because the risk factors are not treated. Integrate mold and damp assessments into public health inspections, making it regular, enforcing it through continuous regulations. Otherwise, you are not getting the building license, let's say, if these things are not in place. Raising the awareness among healthcare professionals to identify and report mold-related health issues early. For instance, if the health professionals are more aware, if the healthcare the GPs, the nurses, the community health nurses are more aware. Even in those home visits, they can actually report. Or if, let's say, if in Awab Ishaq's case, let's say, for example, the child was continuously exposed, but each time he used to go to the GP clinic or seen by the community health nurse, he was being told that, this is just a flu infection, this is just a phasic infection, and it will pass away. But 2 years of continuous infections, that the main cause was basically the spore inhalation that was going on in his house. Next, please. Lastly, I would like to share how to address the social inequities to tackle these fungal disease or the mold exposure. Now, one thing is very clear, because this particular diagram was published in a paper by Lancet, in the Lancet journal, and this basically has sort of divided into different categories and how each sector is facing a social inequality or injustice, and how we can actually work in a more organized fashion. For instance, if I'm talking about just, let's say, the healthcare sector, obviously taking into consideration how we could have good access to the diagnostics and antifungals. That is, if those diagnostic tests are done early, if we get to know if there was a fungal disease or not, if let's say our health professionals are more informed, if their education, if there is obviously their education is being funded in terms of those continuous professional development. If, let's say, we have enough infrastructure in order to separate the vulnerable patients from the construction sites, or making sure that that is in place. Let's say if I'm talking about the awareness and education, strengthening the public health programs, keeping them more informed of what a mold spread disease or inhalation of mold spread, what are the symptoms like? How could you identify it early? What are the tests that you should be getting done? And let's say the tests are not enough. Probably you should sort of initiate an assessment of their homes, or an inspection of their home if there's something which is causing them to have continuous infection. Let's say talking about the more housing and environment, making sure that the housing regulations are more up to date, addressing the leaks, molds, growth, and poor ventilation. If let's say people are stricken with fuel poverty, or if they are living under those dire conditions, making sure that that the government is providing them with enough facilities in order to provide maintenance to their houses, or give, or at least changing their or relocating them to a better place where they are not exposed to such mold. And obviously the structural conflict as well, and the various other factors in what you could do in work, having more PPE, use of PPE, mask hygiene, encourage the personal hygiene. It could be Sarah, because as I mentioned, it is multifactorial, and it is more through intercollaborative efforts that this could be mitigated, rather than a single effort. Yes, next please. Right, thank you. That's it from my end. If there are any questions, I'm more than welcome to take them.
Hey everyone. Right now we move to question and answer season. If you have any question now, please press the raise hand feature or type your question in the chat box. I will helping if you're asking through the chat box. Okay, Miftah, you can ask the question.
Okay, good afternoon, Dr. Sabha. Thank you to moderator for giving me the opportunity to ask the question. My name is Miftah, doctor. I'm fifth semester student in the Bachelor of Public Health program. I would like to ask about the policy discussion that was presented earlier. Are there any difference in policy or approach between developing and developed countries in dealing with mold and damp housing problem? Thank you.
Hello, Miftah. Thank you. That was a very interesting question. One of the things that I would always like to say is, if we are comparing between a developed country and a developing country, we always look into the causative factors of it, right? So as I spoke about different causative factors, it could be structural, it could be climatic, it could be it could be behavioral, it could be cultural as well. So obviously, when we know the causative factors, we treat them differently, and the policies are different as well. One thing is for sure that that one major difference between developed and developing countries is what I've seen is for the developing countries, even though if the regulations are in place, the enforcement is kind of poor in terms of because mainly what happens is that a lot of dwellings are in the poorly developed areas, right, or the rural areas, and where we see that that the funding could be a major problem. That even if the regulations are in place, the enforcement is not there, and even if the regulations are in place, there is improper funding in order to reinforce those laws and regulations. Whereas in developed countries, it is kind of it's kind of easier in order to have the law abidance, I would say, and it is kind of easier in terms of prioritize the funding if there is health care involved. But having said that, as you have seen from the case study, and I'm talking about this happening within the UK, where we have seen that there is still social housing problems, there are still issues with the fuel poverty, and even though the policies were in place, there was not enough policy that was basically saying that let's say if a tenant comes up with a complaint, and the landlord has to meet the complaint within 24 hours frame. So obviously there is continuous improvement of the laws and regulations, and obviously as we get more data from it, or as we see more case studies from it. But the major difference what we have seen in policies is obviously the funding and prioritization.
Okay, thank you for the answer, Dr. Sabha.
Thank you so much, Mifta. Thank you.
Okay, Dr. Sabha, there is a question from Siti Aiza. The question is, may I ask, among the various type of indoor molds such as asparagus, penicillin, and cladosporium, which one is the most found in the household and poses the greatest risk to respiratory health?
Yeah, the most commonly found ones have to be the penicillium and the cladosporium. They are like, the most commonly found, and they can initiate the most common allergic symptoms, such as just the allergic rashes, rhinitis, and like runny nose, fever, and so on and so forth. However, aspergillus, it can lead to aspergillosis, and it does pose a greatest risk to respiratory health because, like, obviously, the development of the pulmonary aspergillosis, or let's say, like, the granulomas that are developed by it, have far more severe health effects in terms of, because it can those granulomas, or like formed by the aspergillosis, can move obviously into your brain, not only to the lungs and like to the kidneys as well. So that has a more severe effect, and it can also lead to pneumonia. Thank you, Isa, for the question.
Okay, thank you, Dr. Sabha. Actually, Ira have a curiosity. You said before that higher level of CO2 and lower temperature is related to mold. Related to mold. So my question is it okay that we have plant inside the house because they are produce CO2? And my second question is, if we is exposed to mold by food, is that causes it has causes respiratory health or like this digestion system?
Yeah, that's a very good question. I'll answer the second part of the question first, because like, as I said, like, if the food is contaminated by mold spores, it does causes more of the digestive symptoms, because what happens is like it does causes a toxicity, and how a particular fungi sort of like works in pathology is like whether it's through toxicity or whether it's through the hypersensitivity reaction, are two different mechanisms. So yes, like when you ingest something and when you inhale something, there are two different ways how they affect. The first part of your question was the CO2 levels, right? So you did mention about the plants, and I would say that's a very creative way of thinking. Yes, that's true. Like having plants at home does improve your air quality index. And by saying that, not every plant, because there are only few plants that have the inbuilt ability to sort of like, take away all the CO2, or like, sort of like, consume a lot of CO2 from the air quality and release the oxygen. Most of them are like, not in that category. But yes, it than what a plant can do, it's mainly for the causative factors that are causing the dampness and poor ventilation and all. It does affect your ventilation, but it cannot overreach the effects of just opening the windows and having fresh air in, and like sort of like keeping your air quality high that way. So definitely it has a role, but I wouldn't say it has a profound effect.
Okay, thank you so much for the answer, Dr. Sabha. And right now, Nabila, you may ask your question.
Okay, thank you. Hello, Dr. Sabha. My name is Nabila. I'm public health student from Universitas Nahdlatul Ulama Surabaya. Thank you for your very informative presentation. I would like to ask a question about public awareness of mold exposures. How can public health professionals play a role in increasing community awareness about the health risks of indoor mold exposure?
Right. Hello, Nabila. Thank you so much for this question, because that also reflects what you can do at an individual level as well. One thing is, let's say if a public health professional is more aware, is more educated about what are the causative factors or what are the risk factors of mold spread, and what are the symptoms, what they can see in the public health. Now, let's say, for example, if you are more aware of the causative factors of the mold spread, you can actually like, go back and you can like, check, okay, what is it that's causing this? What are the causes of dampness? What are the causes of poor ventilation? Or is it why do I see it in this population? Why don't I see it in that population? Why do I see it in this geographic area? Why don't I see it in the other one? Or why only particular population level or the particular age or gender is getting affected, not the other? These are all sort of epidemiological questions that come into play for a public health professional, because the role of a public health professional in terms of education is why is it happening, what is happening, and how you could deal with it at an individual and at a community level. If you're not informed about it, if you don't have the knowledge about it, you do not have the means to action anything, right? So what I think at a public health level is keep yourself informed, keep yourself updated in terms of what the new diseases have come. It is not the role only of the healthcare professionals, I would say. It is also the role of public health professionals as well. For instance, I would say even if the disease of monkeypox had come up or COVID-19 had come up, everyone was affected, isn't it? So keeping yourself informed, up to date about what are the new symptoms, what are the tests that are in place, how can I detect it early, what are the actions that are in place in my community, what I could do in terms of preventing the spread of it, or making sure that that the individuals are protected by it. So having that awareness is important. What we can do is, obviously, let's say if you have learned about it, you can sort of disseminate your information in terms of conducting those community awareness campaigns, let's say even at your community level, or let's say even if at your mosques, you could probably spend 10 minutes or just talk about a particular thing. This is what has come, this is something new has come up, take care of it, take care of your houses, make sure they are ventilated, or make sure you have the inspection in place, make sure your humidity level is below 60%. So just the little things. Or you could use the social media, the best way to sort of inform people about it. That there are various ways of going about it, either if it is a funded project or a non-funded project, what is the extent, what is your target audience, what do you want to do. But I strongly believe every person has their responsibility, to if you're informed about something, it has a responsibility to make sure that that it is the other person is sort of gain some knowledge out of it or gain some benefit out of it.
Okay, thank you, Miss.
Thank you, Nabila.
Okay, Dina, you may ask your question.
Okay, thank you, moderator. Okay, good afternoon, Mr. Dr. Sabha. My name is Audina. Thank you for the very informative presentation. Now, I will ask, what is your view on how socioeconomic factor influence the risk of mold exposure in a community? Thank you.
Yeah, a very good question. The socioeconomic factors, right? I feel if we actually go within the depth of the mold exposure issue, it is the socioeconomic factors, and it is the inequality or the injustice that we see in the social sector that has sort of prompted or that has sort of increased the risk factors. Let's say, for example, as I said, it is mostly seen in the tropical regions, and the tropical regions, not everywhere. It's mostly seen in the areas where there are poor housing quality. Let's say talking about slums, where we see that there is absolutely low quality building material that is used. There is either no awareness or no means or no sort of means to sort of create the ventilation that is required. They have fuel poverty majorly that is seen. That is they cannot keep their houses warm. They don't have enough money to pay the bills, obviously because of the rising costs and everything. Or either you can see they are actually trying to make ends meet. So those sort of issues, they come into play, either because of obviously the economic condition or the employment condition of the house, so on and so forth. That is one of the key factors that I have seen, and it is also seen in people with, let's say, who are like sort of struggling even with the education sector. I would say like either they are not educated, or like they are not educated of what their rights are, or not educated about like how they can actually tackle with this mold and dampness. That's also one of the key factors. Another thing, like if I talk about the socioeconomic issues that the UK is facing, right? One of the key factors that we are facing is that most of the dwellings or the houses that are built in England are quite outdated in terms of like they are not properly insulated, they are quite old, and they're quite poor in terms of energy efficiency as well. So if I talk about the Western Europe, the most least energy efficient houses are found within the UK. Now, having said that, that basically means that there are 19 million households in England, basically, who have poor energy proficiency standards that are below standard B and C. That basically means that that no matter how much energy is being spent to keep the houses warm, they are not enough. They're just causing increased energy consumption and increase in the billing. Now, obviously, that has led to a lot of like issues in terms of like even if, let's say, the mold development, the increased amount of like respiratory health issues, the worsening of health, respiratory health issues as well. So if I sort of relate this at an international level, I would say, and this is what, as I mentioned, this is one of the fundamental factors that we are facing in terms of poor health and mold exposure. That is having to face fuel poverty, having to face like higher energy bills, having to face like socioeconomic issues. That is because we can see there are like huge employment gaps, right? People are struggling with it, and we can see like that there is minimal funding from the government as well in terms of support that could be provided, poor social housing quality as well, and this does like affect your health. And I would not only say about the mold effect, but like in general, like your well-being as well is affected.
Okay, thank you for the answer, Dr. Sabha.
Thank you, Luftiana, for asking.
Okay, thank you, Dr. Sabha, for your insightful answer, and thank you for all participants for your thoughtful question. May I read the conclusion to today's class lecture? Mold is microscopic fungi that thrive in damp and warm and humid indoor and outdoor environment. Exposure to the airborne mold spores and fragments can adversely affect respiratory health that should be not underestimated. This fungus can enter our body through the inhalation, food, and skin. Risk factors for mold growth and exposure include indoors dampness, poor ventilation, water leaks, and inadequate housing condition. Public health efforts emphasizes in the important cross-sector collaboration between housing, health, and building sector to address mold as significant environmental health hazard. Awareness and early identification mold-related health effect by healthcare professional and also critical for prevention and intervention. And right now, we will begin hand over the certificate to Dr. Sabha. Please, to our Head of Public Health Study Program, Mrs. Dwi Handayani, may give the certificate.
Okay, thank you, Dr. Sabha, for sharing your valuable knowledge and expertise as a guest lecturer. We are honored to present you with this certificate in recognition of your contribution. Hopefully, we will have the opportunity to meet in person on another occasion. Thank you.
Thank you so much. I mean, it was a pleasure meeting all of you and like imparting my knowledge. And I'm looking forward to like hosting more sessions with you all. Thank you so much.
Okay, and now we begin with documentation session. I would like to remind everyone to turn on your camera. Turn on your camera and make sure you are visible on screen. I will count down from 3 to lead the documentation. On count 3, 1, 2, 3, cheese. Okay, right now, 3, 2, 1, cheese. On the next slide, 1, 2, 3, smile. Okay, thank you so much everyone for the participation. Dr. Sabat, this is the end of our guest lecture. We appreciate your participation and look forward to welcoming you to the future events. Thank you and have a wonderful day, Dr. Sabat. You may leave the Zoom meeting. Thank you.
Thank you, Pak Edza.
Yeah, sure. You're welcome.
Good job, guys. Good job.
Oke, dimohon perhatiannya untuk partisipan. Saat ini kita akan masuk ke sesi post-test. Dimohon teman-teman untuk bisa mengakses QR scan yang tertera pada screen agar bisa mendapatkan sertifikat untuk acara kuliah pakar hari ini. Jika mengalami kendala teknis, bisa dituliskan di kolom chat agar dibantu oleh panitia. Terima kasih. Thank you for all enthusiasm for today's guest lecture. See you at the next guest lecture. Bye-bye. Wassalamualaikum warahmatullahi wabarakatuh.